Empire Broadcasting presents the Professionals Roundtable, 9 to 2 p.m. Hear what's hot in the professional world. Timely topics to propel your career to the next level. Professionals Roundtable, 9 to 2 p.m. exclusively on Empire Broadcasting.
Good afternoon, everyone, and welcome to Empire Radio's Professional Roundtable. I am your host, Jen Reynolds, and we have a special guest with us today, all the way from Los Angeles, California. She is the owner of LA Speech Therapy Solutions. Let us please welcome Cassi Alter, MA-CCC, and licensed speech language pathologist. Let's welcome her, everyone. Good afternoon, Cassi. How are you doing today?
I'm doing great, thanks. How are you?
I'm wonderful. Thank you so much. Tell us a little bit about yourself and your company background.
Okay, so I am a licensed speech language pathologist, and I've been in practice for over 20 years. I started LA Speech Therapy Solutions in the Hancock Park area of Los Angeles, and recently expanded to a beautiful new clinic here in Silver Lake. We provide speech and language evaluation and therapy services mostly to kids, and we see them in many different settings. We try to make it as convenient for the parents and as effective for the kids. So it can be in homes, in preschools, elementary schools, and of course here in our clinic setting. Recently, because I was able to expand here to a much larger space, we were able to add occupational therapy as well. So that's just been amazing because there's a whole OT gym set up here, and it really, really helps us in treating the whole child, especially with some of our kiddos who have issues with sensory integration, some feeding issues, or some fine motor issues. So when my speech therapists are working with them, they often, will speak to the OTs and get some tips from them on how to just maximize their OT, or OT stands for occupational therapy, so their occupational therapy goals, which may be related to fine motor and sensory issues, which can be very distracting for kids, so we try to help them focus better by using those strategies as well.
Okay, thank you so much about that. Tell us a little bit more about what it is that you do at your facility.
Okay, so primarily, I want to talk about speech and language therapy and what that encompasses. So when people think of speech therapists, a lot of times they just think about, the speech part, like, people may have trouble with S's or R's, and that's obviously something that's very obvious to most people. But the truth is we spend a lot of our time here working on language concerns. So language therapy addresses language comprehension, expression, their kids' play skills, and their social pragmatics, which is that functional use of language. We do a lot of early intervention here. California has a wonderful program through the Regional Center System of California, where children ages 18 to age 3 are able to qualify for services to address their speech and language needs. So these are the kids who obviously either aren't speaking yet, or the parents have just any concern about their development. Really, they can reach out to their local regional center and have them fully evaluated. And if they qualify, then they can get the services. So I just happen to love that population, that 18 month to 3-year-old population. It's such a critical period of development for children. And oftentimes we really are the first stop for parents in terms of, when a child maybe isn't developing the way they should be or as quickly as they should be in an appropriate manner. Oftentimes it's the speech that the parents notice first. And we're often the first stop, in terms of oftentimes the parents just getting the child all the help they need, whether it be also help with their fine motor skills or their gross motor skills or their social pragmatic skills as well. So, what I've noticed over the years after doing this so long is that, a lot of the kids, they fall into about 3 categories once we've started working with them. The first one is obviously the one we were happiest to see are the kids whose comprehension is really good, their play skills are good, social interactions are appropriate. They're just having trouble on the expressive side. So oftentimes these kids will end up being, quote unquote, the late talkers. Everybody has anecdotes in their family about children who didn't say a word till they were 3, and then all of a sudden they were speaking in full sentences, and everything was fine, and they went on to be genius adults. So we love to see those kinds of kids. We love all the kids, but for these kids, in terms of prognosis, that's one of the better ones we like to see. And then we'll see kids who have what you call global delays. That for whatever reason they're just been a little bit slow out of the gate in developing their receptive, their comprehension skills, their cognitive skills, and their expressive language and play. So we work with them. And you may have been aware, it's a lot in the media in the last few years about the higher prevalence of autism now in children. So again, as I mentioned, parents come in here sometimes, with concerns about their children's speech, and oftentimes we see pretty quickly that it isn't just a speech, that these children are actually falling on the spectrum, which is, a certain diagnosis where they have delays in their social and functional use of language. So we have a lot of kids we work with that in terms of, autism. Now, I'd like to move on, actually, and tell everybody I don't want to forget about the speech part, those R's and S's and L's, because we definitely work on those as well. It happens to be one of my favorite things to really work on with the children who let's say, very common, they don't have their K's or their G's where they should be, or they're leaving off the ends of words, or just overall clearing up their intelligibility. And I love to educate parents in terms of what's age appropriate, because I get calls all the time. My child's 3 and they don't have their R's yet, and I just say, don't worry about it. They have at least till 5.5, even 6 to get their R's. So it's good for parents to understand, the order that things develop, so that they can get on the things that are maybe delayed, and then not worry about the other things that will come along. What else do we do here? Gosh, so much. Okay. So in terms of, people also don't realize how important swallowing and eating patterns are, especially in children, in terms of, how their oral mechanism will develop. So I always like to watch the young ones eat and see what they're doing with their tongues, and make sure they're moving side to side the way they should, and they don't end up left with something called a tongue thrust, which is common lay term for, a reverse swallow, let's say, where the tongue is going out when one swallows, out and in, almost in a suckling motion, instead of up and back to move the food back. So oftentimes dentists will get referrals from dentists who are seeing certain dental patterns developing a certain way. It's a very distinctive look of the teeth being pushed out, and they'll refer those kids over to us to see how they're swallowing and what their tongue is doing, to make sure that we're correcting their tongue patterns, especially before orthodonture, so that their treatment can be successful. Okay, so moving on, we also, another category that people are often aware of with speech is, of course, stuttering and fluency problems. And I really want to say that over the years, I have about 25 therapists who work with me, wonderful, talented therapists who I'm so glad are part of my team. I've noticed over the years that many therapists are not trained well in stuttering therapy, because they just don't end up seeing enough kids in their training, and often will shy away from them because stuttering can be a bit of a tricky disorder unless you're well trained. So I'm fortunate enough to have a wonderful therapist on staff with me, Ellie Kempe, who's just terrific, well trained, and has worked with our stuttering children and adults who have issues with stuttering. As far as another area that I've built up over the years is a niche area of transgender voice therapy, and I'd like to give a shout out to Erin Gatellis, who is one of my partners in this project here at LA Speech Therapy Solutions. It's just so well trained and wonderful with our clients. Anyway, so transgender voice therapy really addresses issues that come into play when an individual is transitioning from male to female and female to male, where obviously they would want their voices to match their gender identity. Now, clients who transition from feminine to masculine have a bit of an easier time with this because the hormone treatments that they take do help with lowering the voice and giving it more that male quality. However, a male to female is a lot trickier because the hormones don't affect as much, and the voice can tend to stay lower and more masculine sounding. So we address that in a very, very focused way. And it's not just transgender individuals that need help with their voice. Oftentimes you just have, regular folks, men whose voices have too feminine a quality to it, and they feel they're being penalized at work for it. They want to sound more deep and masculine, and the opposite. Women whose voices are more masculine sounding, and they want them to have a more feminine quality to them. And here I am living in Silver Lake, Los Angeles, very, very much part of the Hollywood scene here. So I also get a lot of referrals for actors and singers who want to clear up some residual articulation issues they may have. Of course, they're going for auditions, and it's such a competitive business. They want to just sound their best all the time. So some of my gay clients want to make sure that their speech, some of them, want to be able to sound 100% heterosexual when they apply for jobs. When they audition, and sometimes within their communities, they may have developed a certain quality to their speech that they feel, I don't always agree, but they feel is holding them back, that they feel that it has a certain quality that they would like to be able to turn off or turn on at will, almost like an accent. So we help them with that.
Okay, that's great. So those of you who are listening, she does a lot of things. She's intricate and delicate, and she helps you not only with your speech patterns, your words, but of other things also. For those of you in the California area, and you need not just speech therapy, but overall speech help, you can visit their website at www.laspeechtherapy.com, or you can shoot them an email at Alter, which is ALTER, at laspeechtherapy.com, or contact them by phone at 323-522-6071. Great information. They do a lot. They cover it all. Not just your typical speech therapist with the typical letters. Very well versed, very informative. A lot of things that they do. So those of you in the California area and you need some assistance, visit the website, shoot them an email, or give them a call. Cassie, I want to thank you so much for coming on the show today. It was our pleasure. Very informative, very interesting.
Oh, you're welcome. Anytime. Thanks for having me.
You're more than welcome. For the rest of our listeners, we'll be right back after these messages.